Okay, welcome everyone again. Thank you for joining us today. My name is Mr. Teh Kok Wai, lecturer from Department of Psychology and Counseling, Faculty of Arts and Social Science, University Tunku Abdul Rahman. I will be moderating today's webinar titled Understanding Dementia and Alzheimer's Disease, shared by Mr. Peh Kai Xuan. Dementia Awareness Series is jointly organized by Malaysia Mental Literacy Movement in collaboration with Department of Psychology and Counseling, Faculty of Arts and Social Science, University Tunku Abdul Rahman, also known as UTAR. Okay, let me have a quick introduction about our speaker today. Mr. Peh Kai Xuan is a lecturer and head of program at the Department of Psychology and Counseling, University Tunku Abdul Rahman, and consultant clinical psychologist sessional at Pantai Hospital Ipoh. He received his Bachelor of Education, Guidance and Counseling from University Putra, Malaysia, and his Master of Clinical Psychology from the National University of Malaysia, where he focused on assessment of specific learning disorder. His clinical interests are in assessment and management of neurodevelopmental disorders, suicide prevention, and his research interests are in improving mental health literacy in the community. Kai Xuan is also a two-time winner of the Best Psychiatry Research Awards at the Malaysian Conference of Psychological Medicine and has published more than 20 scientific papers, both locally and internationally. Later during the sharing, if you have any questions, please type them into the chat box in your Zoom control panel. I will bring them up during the Q&A session at the end of this webinar. All right, now without further delay, let us turn the time over to Mr. Peh Kai Xuan. Thank you.
Thank you, Kok Wai, for the kind introductions. Let me share my screen. Right, so good afternoon, everyone. Thank you for joining me in this afternoon. We'll be talking a little bit about understanding dementia. This is a very quick and very brief introductions here. So we'll be talking a little bit about why are we here today. So we highlight a little bit about the current status of dementia, the prevalence of dementia in Malaysia, and then we understand a little bit about dementia, the 4 different types of them, and some of the symptoms, some of the visual problems of people with dementia, and then some communication tips. What are the things that to speak? How do you talk to them? And what are the resources that you can further learning from here? And then maybe some Q&A. Okay, I would like to acknowledge the followings, these following organizations for providing the resources of the talks today. Okay, so first thing first on what are the issues of dementias that we are having. Worldwide, about 55 millions of people are living with dementia, and 60% of them are actually living in the lower and middle income countries, including Malaysia. So you may notice that dementia actually happens more often in lower and middle income countries as compared to those developed countries. Clearly, there's a socioeconomics inequalities over here. Main reasons is people with lower middle income countries has poorer nutrition, has less educational support, and also has less treatments. Okay, and people with dementia, the projections of number of people with dementia are increasing. If you are comparing in 2019, probably 2 years ago, 55 millions. And in the years to come, in 8 years' time, we are expecting about 78 millions worldwide. And by 2050, it's almost double up, 139 millions. Dementia is the 7th leading cause of death amongst our older persons. 65% of dementia-related death are in women, especially. Women are at a higher risk of dementia as compared to men. 1.3 trillion of US dollars estimated global cost of dementia in 2019. So you can imagine that dementia actually costs a lot, 1.3 trillion of ringgit. So other than this, the issues are on treatments and then also the productivity loss. When dementia happens, it doesn't only affect the people living with dementias, but definitely also their family members. So the caregivers, just statistics. 2019, 9,000 per thousand, 123,000 of people By 2030, we are expecting 261,000. And by 2050, we are expecting 590,000. So as you can see over here, by 2050, I would definitely be in the age of 60 plus. So I probably contributing to one of these numbers. Most Malaysians are living longer and longer. Our life expectancies are increasing every year. By the same time, chronic diseases and related diseases are increasing as well. Okay, so we probably have add years to life. People are living longer, but we are not necessarily add life to the years. The longer you live, does not necessarily means that you are living better. Two-thirds of people with dementia are women. So there are gender discrepancies. Mainly two reasons. Some people suggest, some clinicians and scientists suspect that these women's menopause, lack of this feminine hormone, your hormonal changes after menopause is one of the contributing factors. Another reason is it is also known that women are actually living longer than men. So probably men are not living long enough to develop dementia. Okay, at the end of at the end of life, 1/3 of people will have dementia. So that's about 30%, which is quite a huge numbers. And it is most common in older persons, but it can also develop among younger people. So dementia can develop at any age. Many of us probably thought that when we think of dementia, the first thing came to our mind is people with an older persons. Yes, it is most commonly happens in older people, but it can also happens in younger age. So for those who are aged 40 to 60 years old, it happens in 1 in 1,400. So 1,400. 65 to 69, about 1%. So this is the young old group. The middle old group, so 70 to 79, about 1 in 25, which is quite a lot. 80 plus is 1 in 6. Okay, so as you age, as you get older, the risk of dementia increase as well. Right, let's look at show you a short video clips of what is dementia, and then we'll explain more.
What is dementia? Dementia is the name for a group of symptoms that commonly include problems with memory, thinking, problem solving, language, and perception. In a person with dementia, these symptoms are bad enough to affect daily life. Dementia is not a disease in its own right, and it is not a natural part of aging. Rather, the symptoms of dementia are caused by different diseases that affect the brain, including Alzheimer's disease. Dementia is caused by a loss of nerve cells. It is a progressive condition, meaning that symptoms gradually get worse. This is because when a nerve cell dies, it cannot usually be replaced. As more and more cells die, the brain starts to shrink. This can sometimes be seen in a brain scan of someone with dementia. These scans show a slice through the middle of the brain from the front, like looking through the middle of a stick of rock. They show what happens to the brain of someone with Alzheimer's disease as their dementia progresses over several years. Note how the black areas become larger. This is because the brain tissue, the grey areas, continues to shrink or atrophy as nerve cells die off. Common symptoms of dementia include problems with day-to-day memory, concentrating, organising and planning, as well as difficulties with language and visual perception, and changes in mood. However, each person will experience dementia differently, and the symptoms depend on the areas of the brain that are affected. For example, if cells in the temporal lobes start to die, that person might have difficulties with their language. Nerve cell death in the occipital lobes can cause problems with vision. There is currently no cure for dementia, and many of the diseases that cause it are terminal.
Right, so this is short video clips from Alzheimer's Society UK. So briefly explain about what is dementia. We'll talk a little bit more about this. If you have questions, feel free to put into the chat box. We will discuss about the questions later.
What
Now, so what is dementia? It's a term used to describe a group of symptoms involving deterioration. The main problem is the main problem with dementia is the deteriorations of the brain functions. Our brain function become poorer and poorer in the following areas. In many different areas. So, including of orientations, comprehensions. Orientation, as in where are you? What is the time now? What is the day now? Your comprehensions, okay, whether you can understand certain things, the way of your thinking, your learning capacity, whether you can learn new things or not. So for example, one good examples would be learning smartphone, because in the past 5 to 10 years, our smartphone apps are keep updating, and then the smartphone functions are keep updating. So scientists has been trying you throw a smartphone to a 3 years old, and versus you throw a smartphone with someone with dementia. Eventually you'll notice that people, the 3 years old kids that have never seen a smartphone, they'll figure out how to operate, how to use a smartphone after an hour. But people with dementia probably will still struggle with that. Memory, language, okay, calculations. These are obvious ones. Judgments, they probably no longer able to judge the situations, whether that situation is right or wrong. So a lot of scammer, they easily fell into those banking scam or traps. People call them up, say that this is a call from the court or from the police. They would they're very scared, and then they probably give up their money. So they become poorer and poorer in terms of judgments. Abilities to perform everyday tasks. Okay, so including making a cup of coffees, dressing themselves, and then probably cleaning themselves. These are the tasks that they used to be able to do, but then slowly, as the disease progressed, they will lose these abilities. Okay, so what are the types of dementia? So just now, dementia is actually an umbrella term being described in a lot of different diseases. There are many different types of dementia. So Alzheimer's disease is one of them. Okay, their early onset Alzheimer's disease usually happens to people below 65 years old. It can happen as early as 40, or I'm not too sure whether there are something earlier, but it can be as early as that. Normal onsets. And then vascular dementia, or also known as multi-infarct dementia. This one is due to the ruptures or the blood vessels in the brain. We will look at it a little bit more later. Lewy body dementia. Lewy body is actually a type of protein that affects the neuron, the nerve cell, the brain cells. So it's called Lewy body dementia. Frontal temporal lobe dementia. So this one affects the frontal and the temporal lobes of the dementia, specific parts of the brain. And then there are other forms of dementias that due to metabolics, drugs, white matters, mass effects of infections, Parkinson disease, Huntington diseases. These are some of the things that can be affected by dementias. So in general, one of the questions that someone asked, whether dementias and Alzheimer's are the same thing. Dementia is an umbrella term. Under dementia, there are many different types. Alzheimer's is one of the types. Of course, a lot of people know what is Alzheimer's dementia, but probably not many people are aware of what is Lewy body dementia or vascular dementia, because we are less heard about this. Okay, so this is on dementia. How do we diagnose dementia? How the psychiatrists diagnose dementia? One of the things that we do is, according to the DSM, Diagnostic and Statistical Manuals of Mental Disorders, currently in its 5th editions on the text revision. So this is a new manual. This is the latest version just published earlier of this year in March. So evidence of significant cognitive decline, their abilities, their functions are declining on learning and memory, language. Executive functions. Executive functions basically means that your planning, organizations, short-term memories, whether you can control yourself, you know that you're not supposed to do certain things, whether you can control yourself. We call that as inhibitions. Complex attentions, whether you can pay attentions on in a noisy area, whether you can still pay attentions, whether you can still look out for things in a pay attentions to detail. Perceptual motor, okay, this one got to do with their understandings in terms of whether they can still their eye-hand coordination. So for example, if you want to make a cup of coffee, you want to pour hot water into coffee, that requires some perceptual motor skills because your eye and your hand need to be able to coordinate. So cooking, of course, that's also perceptual motor. Social cognition as in whether you understand what others people are trying to tell you, what does that mean, you know? So whether they know or don't know whether they know that they shouldn't say something that is socially inappropriate in certain situations. So an examples would be they probably won't tell you, won't say their secrets in front of others people. So such as for examples, if you were to tell the others, you won't ask for the people that we met the first time. We don't usually ask about how much you earn, what is your salary, you know. So this they probably ask such a question because their social understanding is out already. Of course, these deficits would interfere with independence of their daily life. Okay, they need some assistance. The cognitive deficits does not exclusively in delirium. Delirium is another very confused state. Often frequently happens in older person as well. Sometimes it's a little bit like mabuk lah. After people are drunk, they are in a delirium state. But it usually happens due to malnutrition. Sometimes after older persons who went through a surgery and operation, after when they wake up from the anesthesia, they will develop a little bit of delirium. But delirium usually happens only for a few hours, or usually very rarely it lasts for a few days, but most of the time just a few hours, then they will be okay. Or if you correct the malnutrition, then they will be okay. It's not better explained by another mental disorders. Other than this criteria, in Malaysia, before a clinician diagnose dementia, usually the doctors will also run a blood test to rule out some reversible causes. So for reversible causes such as sometimes lacking of certain nutrients can cause that. Lacking of sodium, too low of sodiums, too low of kaliums and others. Sometimes dehydration can also induce symptom looks very much like dementia, but it may not exactly dementia. So a blood test necessary. Some doctors would advise to go for brain scan. That one is to help you to determine which type of dementia is it. Okay, so there are different, especially like vascular dementia, there will be multi-infarct. Okay, blood vessels are ruptures in the brain. Okay, so what are the symptoms that we usually see? Forgetfulness. They often forgot a lot of things, and this forgetfulness is probably happens on almost every day. Okay, so once a while you forget certain things, something slipped through your mind, don't worry, that's fine. So this once a while means that it happens, let's say every 2 weeks you forgot something, that's fine. But if you forget about you're boiling the water 3 to 4 times in a week, then that is something that we probably need to concern of. They started to have communication problems. Okay, the way they communicate, they talk to others, they often have started to have some difficulties. Can be presented with anxiety, can be presented with change in personality. They used to like to go out very much. Okay, they probably are quite outgoing. Now they suddenly change into become someone that was very introvert. They stay at home most of the time. Mobility problem. They cannot stand, when they walk, they tend to fall down, they cannot balance themselves. So sometimes when older persons, when they have a fall, we probably want to also, after treating the fall issues, you probably also want to check whether there's a dementia so that we can prevent the next fall. behaviors which are challenging, okay, challenging behaviors. We will talk a little bit more about this. Sometimes they develop a lot of difficulties in behaviors. They wake up in the middle of the night insisting that they wake up at 3 a.m. insisting that they want to go to market at 3 a.m. They probably keep eating, won't stop eating. You tell them that they have eaten, they shouldn't eat so much, but they keep on eating. Some of this behavior can be very challenging, very confused, living in the past. So some people with dementia, their recent memories are usually are the one that who lost, and then they thought that they were living in the past. So personally, my grandmother was living with dementia before she passed away. So I remember that probably before she passed away, right before she passed away, there was once I visited her. She still hold the impressions that I was still studying in secondary school. That time I actually already came out to work. I'm already working, but her impression on me was when I was in secondary school. So when she saw me, she's asked me, have you finished your homework? You don't have any tuition class today? Those kind of things. So they are living in the past, probably 20 years, 30 years ago. They lost their abilities of recognizing people. So recognize facial expression, recognize people is an ability. And so some people are losing, when they have dementia, they lost the abilities of recognizing people. So people, sooner or later, I think this is the most heartbroken moments. Many of the caregivers have shared this with me. Their spouse wake up in the mornings and they don't recognize their spouse anymore. They probably married to each other for 30 years, but one day you realize that your husband or your wife with dementia wake up and don't recognize you anymore. Repetitions, they keep on asking the same questions or they say the same words, same phrase again and again. Wandering around, wandering behavior is also very, very common. They walk aimlessly, they go everywhere. They cannot sit still. You get them to sit still, they sit down for a while and then they start walking around aimlessly. You ask them where are they wanted to go, they don't know where they want to go. Sometimes they will give you a name, but even they tell you that I want to go to, let's say they tell that I want to go upstairs, but they're actually going downstairs from the staircase. So this wandering around would be an issue. Alzheimer's basically is the most common cause of dementia, a physical disease that affects the brain. The main problem is the plaques and some tangles developed in the structures of the brain, usually leading to the death of the brain. So there are some plaques, some forms of plaques that happens in the brain, and then because of those plaques, the brain cells die. Often happens in the temporal lobe. It leads to a shortage of some important chemicals in the brain. Over time, the brains are damaged. So these plaques are called amyloid plaques. Okay, so these things that you can see. So plaques are some of the substance that we don't really want. This is a normal, healthy neurons, and these plaques can actually cause the brain cells to die. Neurofibrillary tangles, some of the tangles that it develops on the brain cells, as you can see. Okay, so this is the most common types of dementia, Alzheimer's disease, due to amyloid plaques, and then some of the tangles. Right, these Alzheimer's diseases, these are the cells that you can see. With over here the plaques, and then these are the healthy cells. People with Alzheimer's disease may become more confused. Frequently, they forget names and appointments and recent events. They have mood swings, feeling sad, angry, scared, frustrated as well. Become more withdrawn, either due to a loss of confidence to communicate their problems. People with early Alzheimer's disease, very mild Alzheimer's disease, early dementia, they usually are aware of their problems. So their confidence become affected. They don't dare to talk to people. having difficulties to carry out daily activities, checking the change at at their shop. So they buy things, they give people 10 ringgit. People are supposed to give change to them 2 ringgit. So how much change they should have? They started to have problems with that. They have problems in operating the TV remote control, something as easy as TV remote control. Of course, nowadays we are using smartphone. Smartphones are even more complicated. It's even more difficult. And then we have vascular dementia. The problem with vascular dementia is the supply of the blood to the brains. Okay, so let's look at the pictures. You can see that these are usually vascular dementias are due to strokes. So because the high blood pressure, heart problem, high cholesterol, and diabetes can cause vascular dementia. So in strokes, hemorrhagic stroke, the blood vessels are weakened and then it ruptures. So the blood came out, the blood leaks into the brain tissues. In ischemic stroke, these are because of blood clot stops at the flow and area of the brain. So this is the vessels of the brain, and then because of high cholesterol and high fats and things like that, your unhealthy eating, so there are some build up over the blood vessels. The blood cannot pass through. People develop ischemic stroke. So after strokes, they develop dementia. People with vascular dementia may experience problems in concentrating, communicating. Depression is very, very common. Physical weakness, paralysis, memory problem, step progressions with symptoms, seizures. Seizures is the fit. Periods of acute confusions. Around 10% of dementias are actually Lewy bodies dementia. That's another types. Okay. And then, so what is Lewy bodies? They are tiny spherical protein deposits at the nerve cells. They disrupt the brain's normal functionings. So this is Lewy body. It's a protein in the brain cells. Okay, it's a spherical shapes. So over here you can see that these are the this is the normal brain cells, the neuron nucleus, and then they are Lewy's body. Okay. So Lewy's body dementia, they have problems with attention, alertness, disorientations. They can develop symptoms of Parkinson's disease, including they started to become slow, walk down, shuffling when they're walking, trembling, loss of facial expression, change in voices and strengths and stuff like that. Okay. They also experience detailed and convincing visual hallucinations of often people or animal. This is a challenge of Lewy's body dementia because they often have hallucination. They started to see, it can scare the family members quite a bit. They see people who have died already, you know, their friends, their family members. Sometimes they see they are seeing someone that's not there. Okay. But the hallucination is quite vivid and quite convincing. Their abilities are fluctuating daily, sometimes even hourly. There are times that they are very good, they are okay, they are doing very well. There are times that they are not okay at all. Fall asleep very easily during the day, a very restless, disturbed night with confusions, nightmares, and hallucination. So this is the challenges, Lewy's body dementia as compared to other forms. Daytime, they sleep very easily. Then at night time is the time that they are active. It's not only active, but it can be also with behavioral disturbance. Okay, very confused and lots of nightmares. Faint, fall, or have funny turns. These are quite common. So another type is frontotemporal dementia. So what is frontotemporal dementia? This is our healthy brain. So frontotemporal dementia affects the front part of the brain. Sorry, this is the wrong pictures. The front part of the brain as well as the side part of the brain. So this part of the brain and then the front part of the brain, frontotemporal dementia. So what happens to frontotemporal dementia is these two parts of the brains are actually shrinking. Okay, become smaller, shrinking. So they started to have the things with frontotemporal dementia. Sometimes it's also known as peak disease. They have very poor judgment, loss of empathy with others people. They don't know how others people feel. They lost their judgment on what should they do, what are things that they shouldn't do. Socially inappropriate behaviors. Many years ago, I think what was a very famous, a very popular person's was being caught, and I think he was 70 over years old. He was caught of inappropriately touch of females. So this is a man, very famous, very popular man, very well respected in the community. But he was caught to touchings and kissings females in the public, right? And strangers female. So of course being caught of so-called sexually harassed, but there's actually some other problems behind it. Lacking of inhibitions. During daytime, we usually know that there are some certain things that we shouldn't do. For example, you're very angry with someone, but you are very angry and you know that you cannot hit people. That's not right. But they lack of these abilities of saying no, of doing certain things. They cannot control themselves. Repetitive compulsive behaviors, inabilities to concentrate or to plan, frequent abrupt mood changes, speech difficulties. When they speak, they started to have difficulties to find their words. They don't know what to say. Problems with balance and movements, of course, memory loss as well. Okay, so brain atrophies, that you probably heard of this in the video just now. Brain atrophy basically means that shrinking of the brain. So this is a healthy brain, and then this is a brain with Alzheimer's disease. So it shrinks over the time. Okay, and then the black color area, this is something we call ventricles. Okay, the ventricles become very big because the entire brain has started to shrink. Progress of dementia. Now, normal aging is the first green color line. Okay, everyone experiences slight cognitive changes during aging. Usually, these slight changes is something that people cannot, others people don't usually detect it. Okay, and then you probably become slightly more forgetful, slightly as in you probably forgot your keys maybe once a month or twice a month. So not something that happens very frequently. Okay, sometimes it takes you slower to learn new things. So for example, you want to learn about new apps in your smartphone, it takes you a little bit more time to learn it. So all of us, everyone experience some slight changes during aging. And then it comes to this preclinical phase. What is a preclinical phase? Also known as silent phase. The brain changes without measurable symptoms. Okay, the brain already started to have some changes. Okay, some of the symptoms, some dementia started to develop, but we cannot detect it. We cannot test it using tests. This is a challenge. We don't know why it happens and how it happens. Individual may notice changes, but not detectable on tests. So if you do a cognitive assessment, a test on them, they usually turns out to be normal. And a stage where the patient knows that something is wrong, but the doctors doesn't know. Okay, so people are asking whether people with dementia, whether they will know that they have dementia at the preclinical stage and then the MCI stage. They usually know a little bit about their conditions. And then it comes to MCI. MCI stands for mild cognitive impairment. This is a very, very early stage of dementia. It have not gone into dementia yet. The cognitive changes, their brain function changes are concerns of individuals and family. Others people can notice it. You become more and more forgetful. They themselves usually aware of it because a lot of things are slowing down. One or more cognitive domains are impaired significantly, either their executive functions or either their memories, their language, certain things have been significantly impaired. Preserve activities for daily activities. Okay, so in MCI, one of the difference between MCI and dementia is their daily activities, they have no problems, they can go on. Preclinical, definitely they have no problems in daily functioning. They can still go on daily life. They notice that something is off, but when they go and consult doctors, the doctors usually says that, your memory test shows that you're okay, so not to worry. But after a few years, they probably started to progress to MCI. Okay, once you have MCI, so although your preserved, although your daily living is okay, but slowly it will move down to dementia. So mild, moderately severe, and very severe. Cognitive impairment in the dementia is very, very severe. It's usually very obvious. People can see that already. You notice that the speech is off. Okay, so these are very poor dementia. So these are different areas, different progresses, and it's a slow progress. There are people that in the green color line, okay, you are still normal. There are people that slowly progress like this, okay. There are people that progress like the blue color line. They have an MCI, then the MCI will not, then they stay in the MCI stage for long periods of time. And then of course, this is the red color line. These are more severe forms of dementia. Mild dementia, what you can expect, easily confused on certain things. So when people speak too fast, when people suddenly throw you a lot of information, you get confused. Like right now in the talk, I'm throwing you a lot of information, so you get confused easily. Misplacing items more frequently, mood changes, loss of interest in previous activities, difficulties in remembering names or words, displaying poor judgments. Moderate dementia has increased agitation, suspicious. This is one of the challenges in dementia. They started to develop a lot of suspicious, suspect that their partners are having affairs outside, suspect that others people steal their things. They suspect that others people are plotting against them, want to do something bad on them. They started to have changing in sleeping patterns. Some of them, they sleep during the daytime, but they cannot sleep at night. Some of them, they sleep after 3 hours, they sleep at 12 o'clock. 3 hours later at 3 a.m., they wake up and then they wake you up as well. Worsening memory loss, confusion, poor judgments, inability to perform daily activities, worsening symptoms, you sometimes known as sundowning. Usually, daytime they are not too bad, but after the suns go down, sundowning, then their symptoms are worse and they have more challenges, more difficulties. Severe dementia, they would come to a stage of having difficulties in swallowing, bowel movements, bladder control. So they will need to, many of them are probably bedridden, or they need a full-time caregivers already. Okay, requires round the clock care, 24 hours care, extensive memory loss, limited mobility, cannot move, bedridden most of the time. So once dementia started, MCI, they are now, now what we know is that hopefully we can detect at preclinical stage, which is very difficult. MCI, yes, we have quite reliable instruments. We have quite reliable methods of detecting MCI. So once MCI is started, we can actually do some treatments and intervention to prevent the MCI from worsening. Slowing down, I don't dare to say that it's 100% possible to prevent. There are some people that they develop MCI, but then they stay at the MCI stage. They didn't proceed to dementia. But most people with MCI, half of them, they will progress to dementia. And then once dementia started, it will progress very fast, very poorly. Okay, so things are getting from bad to worse after dementia. So it is not curable. There's no way to return once the disease started. Okay, so this is BPSD, behavioral and psychological symptoms of dementia. This is usually the very challenging one. And in my clinical practice, these are usually the main reasons why people seek help. People come to see lots of older persons being referred to see me, not actually because of dementia. They don't even know that they have dementia, but they come to see a psychologist because of one of these behavioral problems. Physically aggressive, they can hit people, they can have physical fights with others people. Sometimes they hit young children as well. So remember one case that I saw. Initially the parents bring in the children to see me. Okay, and then after talking to the child, because parents are working and the child was taken care by this grandmother. So initially they wasn't aware of it, but the child was referred to me because of physical aggressive. When I talked to the child and understand more, the child told me that he was being hit by the grandma. Initially, family members wasn't believe in it. Then they install CCTV at home. Then they actually see that the grandmother hitting the child. the family members was a little bit angry towards the grandmother initially, but I told family members of bring grandma here and let's have an assessment. And it turns out that grandmother actually has dementia. It was undetected, so untreated. Then aggressive behaviors happen. Once we treated the dementia, he was started on medication. He was much calmer, and then no more less issues of physical aggressive. So it is treatable. Screaming, restless, agitation, catastrophic reactions. So small little things, they react very, very extremes. So they probably shout and yell for a very small little things. So someone probably probably this was, I remember one case, an older person with dementia. He was watching TV. So one of his family members walked past him. So of course, walking past, that's something that's very small little things only, but he was shouting, yelling, making a big fuss of it. Wandering around, as I mentioned, culturally inappropriate behaviors. So I've seen some people inappropriate sexual touch. They say things as inappropriate sexual disinhibitions, hoardings. Sometimes they can keep. They like to hoard. They started to keep a lot of plastic bags unused. Small little things. Some of them even go and pick up rubbish and then they keep at home, cursing others people. Anxiety, depression, apathy. Apathy is no feelings. Hallucination, delusion. Delusion is the one that can be a little bit disturbing because they keep on suspecting others people want to do bad syndromes. They thought that there are others people. Sundowning, elations. They suddenly become very, very excited. Negativism is they lost some of their lost motivation. Sometimes they don't have feelings, those kind of things. So a lot of them came to see a psychologist because of PTSD, but when we assess the memory, assess the cognitive, we found that, okay, it's probably also dementia. So and managing this is very challenging because of older persons. Sometimes they have lots of other physical health conditions. So the medications that can give to them is limited. There are medications that can help, but medication can only help you to a certain extent. Usually, it would reduce the symptoms by 30 to 50%. The other 30 to 50% depends on the caregivers. There are ways that we can learn how to talk to them, how to, we discuss some of the communication skills to prevent some of these problems. So sometimes the aggressive behaviors can be maybe verbally abusive, can be physically hitting, kicking, punching or others people. This may be caused by they feel frightened or humiliated. They feel frustrated about their lack of understanding of communications or problems. Sometimes they have a problems. They want to tell you something, but they cannot tell you because of their abilities of cannot find words, their language problems. They keep on telling you that one, do you remember that one? Do you remember that person? That person, I'm talking about that person. Then you ask, who is that person? Which that person? That person, I told you that person already, you still don't know that person. So they keep on using those articles that are non-specific. So the one who is listening is very frustrating. The one who is talking is also very frustrating. Dementia have eroded their judgments and their control, loss of inhibition, decrease of awareness of inappropriate behaviors. So what happens is sometimes their feelings is okay. What happens to people with dementia is their feeling is fine. They still have feelings. If you shout and yell at them, they know that you are angry and they don't like it. They like to be treated properly. They like to be treated with respect, and they want you to treat them politely. But their logical thinking and reasoning ability has lost. Actions, behaviors, they still have it, but usually because they don't have thinking, logical, reasoning abilities, their behavior, their actions sometimes is out of the norms. It's inappropriate. So this is a bookshelf model of dementia. Some people say that usually we organize our things that childhood. The bookshelf is one step. So the most recent one is over here. Your childhood is over here. But people with dementia is upside down. They remember things that in their childhood. But the one recent one, they no longer remember it. So you can make a lot of difference, a lot of how can you help them? So if when they go and see a healthcare staff, healthcare professional, make sure you tell the if the person has a diagnosis of dementia, make sure you let the doctors know. They may need longer appointments. So sometimes when you talk to them, you need to talk longer time with them, and they will consult the doctors longer as well. Okay, so many people with dementia, sometimes I have met families members say that, yeah, I know dementia, and dementia, there's no return, there's nothing that you can treat them. There's no way that they can recover. They cannot be cured, so no need to see a doctors anymore. I don't agree with that. I think it's important that they don't fall out of the system. They continue to come back for follow-up, because usually people with dementia, as I say, the disease are progressing. At different stage, you will have different problems, different challenges, and you will need advice from the doctors of how to manage all those challenges. So continue seeing a professional is important. Include family carers, caregivers in decision makings. Ensure family members have relevant documents, all the letters, monitoring equipments, appointments, changes of medications, and stuff like that. So those who have inappropriate behaviors, you probably want to request letters from your treating clinicians stating that this person has a dementia, so he may display socially inappropriate behaviors, just in case sometimes they go into police stations due to their behaviors. Continuity of care is important. It is better to seen by the same healthcare professional in each visit. This is a challenge in our system, especially if you go to government hospital. Every time you see you see different person, and this can be very confusing for people with dementia. So if it is possible, try to arrange your loved one with dementia to see the same person all the time, so that the persons can have a better follow-ups. Visual difficulties. There are two types of visual difficulties in dementia. One is hallucinations, and then visual misperception. Hallucination is they see certain thing that is not there. This is very, very common. Okay, and then especially Lewy body dementia. Visual misperception is they see certain things and then they think of something else. So, for example, this is a bathroom with a bathroom with a mirror. So, because the bathroom has a mirror, when the person's go in and then he came out, go in, came out, go in, came out. Why? Because he thought that inside the bathroom there's someone else. They cannot recognize themselves, and then with the mirror they thought that there's someone else inside the bathroom. So this is a lady says that there's a mouse in the bin. So you can see this is a dustbin, and they say that this is a mouse. There's a mouse in the bin. So they misperceive things. This is a couple in dementia unit was mistakenly for a pond with goldfish and lily. So an older person started to she wanted to feed the fish. Want to put in some fish food in the cupboard. This lift looks like a corridor to somewhere. So you can see the floor. Even this is a very normal flooring, like our airport flooring. It looks like very slippery, confusing for them. So ways of communicating with dementia, some of the tips. Number one, be clear in your communication. Use very simple words, very short sentences. So short sentences means that your sentence should not be more than 5 words. And then short, simple sentences. Get their attention softly. So when you want to get their attention, you go in front of them, look at their eyes, call their name. So you don't shout. You don't call their name at the back. Sometimes we are in the kitchen, they're in the living room, so you call their name from the kitchen. So that doesn't help. So what's more helpful is you go in front, okay, to them, look at their eyes. If physical contact is needed, then maybe you touch on their hand, on their palm a little bit. Okay, so never ever touch them from their back. That would give them a shock. Okay. Most of the time they probably don't recognize you. Okay, especially moderate and severe dementia. If they don't recognize you, don't get upset. You want to introduce yourself first. So you say that, hey, uncle, my name is Kai Xuan. I'm your clinician. I'm your daughter or so and so. Grandma, I'm your grandson. My name is Kai Xuan. Let's have dinner. Okay, so you say so introduce yourself. Give your instruction in short. Make sure that they understand your question. If you want to ask question, ask a very short question. So only one information are being asked at one time. Sometimes they ask, do you want to have lunch? What do you want to have? So that's two questions already. So you ask only one question at a time. Be patient. Don't point out their mistakes. If they make a mistake, don't say that that's wrong, that's not right. What you need to do is you just make it right for them. Okay, or you tell them how to make it correct. So don't say that you are wrong. Okay, don't say that you screw up again. Make sure that you don't put them in a stressful situations. A lot of people this one I see this very, very, very common in family members. You already know that they have difficulties in recognizing face, and then they somehow want to ask, go and testing, go and ask, hey, do you know who am I? Do you recognize me? This can be very stressful. So no point of doing this. Well, what is a better option is you just go and go instead of quizzing them, go and tell them who are you. Never reasons with them. Never argue or reason what is right, what is wrong with them. That doesn't help. You divert their attention. Never shame them. Hey, this one also you don't know. Shame on you. You pass movements on your pens again. So distract them. Instead of lectures them, reassures them. Instead of asking them, remember this, remember that, then you can do the reminiscence together. So can tell them that, hey, last time, 10 years ago, we used to go to that place. You tell, you don't ask. Do you remember we came to this place 10 years ago? Instead of asking them, there's no point. Instead of I told you so, so you probably want to repeat and regroup. Instead of say you can't, you find out what they can do. Instead of commanding, asking them, demanding what to do. So you ask and model. So tell them that you want to make coffees. Instead of tell them that make your own coffee, well, probably you want to model, get them to do it together with you. Use a lot of encourage and praises, use reinforcement. Okay. 58% of people with dementia thinks that their quality of life has become very bad after dementia developed. As you can expect, 52% thought that the care provided was fairly bad or very bad. This is concerning because dementia is being treated and then they're receiving certain forms of care, sometimes in the nursing home or something like that. But more than half of the people thinks that the care that they receive are very bad. 61% thought that inclusion in the community was fairly bad or become very bad. They are being excluded. They cannot integrate with the community in the society anymore. So that becomes a problem. As I say, yes, we know that dementia has no cure, but what we want to do is to improve the quality of life. Let them make sure that they live as comfortable as possible. People with dementias by the community can help by better understanding of them, less social stigma, more public awareness, more campaigns like this, more talks like this, more local activities and opportunities to socialize, more tolerance and patience from others people, and more community spirits. Okay, because we won't know, either of us, when we grow old, we can be there. Awareness is the key, definitely. A lot of awareness, knowledge, and of the conditions. How do we communicate? And person-centered care is something that people talk a lot in these days. I'm not going to spend much time on talking about this, but generally, person-centered care is you put the person with dementia in the center, so they have their rights. We need to treat them respectfully. Okay, what are the risk factors of dementia? What are things that cause dementia? Age, very obviously. Lack of physical exercise, sedentary behaviors. So this is one of the risks. A lot of us now, we are doing office job, and we're very lacking of time in doing exercise. Like my job, sitting down 8 hours, 10 hours a day is not very good. Obesity affecting half of Malaysians. This is one of the main risk factors. Mental activities in midlife, because many people at the 40 years old and above, they started to settle down in their career already. They no longer do new things. So you are settled down. You're probably a manager in your company. You repeat the same thing again and again in your daily life. There's lack of stimulations. Diabetic, current smoking, But people who smokes, usually they don't live long enough to develop dementia. Many people who smoke, they die at the early 70s. Before they develop dementia, they already die of some other diseases. But if you do smoke and you survive long enough, chances of dementia are higher. Excessive alcohol intake, genetics. So dementia is inheritance. People with intellectual or learning disabilities also have a higher risk of developing dementias. Okay, so these are some of the risk factors. Modifiable factors, what are things that we can modify? Diets. Okay, you can choose your diet. Choose Mediterranean diets, which is more vegetables, more fruits. Okay, less carbohydrates, less fat. Cognitive stimulations. Make sure you keep on learning new things. Pick up a new language. Go and learn a new language, even though you are in your middle age. Make sure you keep on learning new skills. You have new skills. And then physical exercise, daily physical exercise, very important. 150 physical exercise, we should maintain 150 minutes moderate intensity exercise per week. So 150 minutes per week per day is about 25 minutes to 30 minutes okay, of physical exercise. That's very helpful. That will preserve your brain health. Harmful diabetes, smoking, high cholesterol, midlife midlife blood pressure can be predicting. Now, a recent study found that as early as 40 years old, 35 years old to 40 years old, your health status already can predict whether you can get dementia or not. So if you have any of these, please quit now. Please modify your lifestyle, change it. Then you would then your brain will be then your brain can be healthier later on. Only 1/3 of people with dementia has a proper diagnosis. Early diagnosis is very important because early diagnosis means that early intervention, we can slow down the disease progress. Number two, we have more time to plan ahead and support the self-management. The carer can cope longer. Okay, if they are properly prepared, then they can cope longer. The need of placement in the patients of the needs of going to nursing home is delayed. If we treat early, if we diagnose early, treat early, then they no need to go to nursing home so early. A lot of time, the cases I'm seeing now is that they came in pretty late. So suddenly they came in due to others with behavioral problems. I tell them that your loved one actually have dementia. So it becomes something that they cannot accept. So if we can diagnose earlier, we can some treatments can be done. Supports for caregivers and family. This one, the third one in this series of talk, my colleague Kok Wai will talk more to you, but some general information including I think it's very important to arm yourself if your family members, caregivers, extremely important to arm yourself with knowledge. Okay, WHO recently launched online training programs for caregivers of dementia. Get help as a caregiver, see a clinical psychologist or psychogeriatricians who are familiar with the problems of dementia. Get advice from the dementia, get advice from them get advice from them. Dementia Association Societies, carer assessment, get support groups, daycare, home care services. This is a WHO online training course that I mentioned. So if you're interested, you can go and Google WHO I support for dementia, then you will get the course. Go and attend the course so that you learn how to equip yourself. Okay, there's one more video, but I'm going to skip it, lack of time ready. What else are the things that we can do? Improve the patients. Generally, there are lots of things, but what we are trying to do is to improve their quality of life. Okay, where to get more information? Alzheimer Disease Foundation Malaysia. This is they even have a helpline phone numbers that you can call to ask for more information, to ask for support. Para Dementia Society in Ipoh. So these two centers actually run a daycare centers, and then there are lots of caregiver support program that you can find out more. So Alzheimer Disease Foundation in Kuala Lumpur, Selangor, this one in Ipoh. Others informations, international resources, you can always find out more from the internet. You can read more. Thank you very much. So this is my email address. If you have any further questions, you can feel free to contact me later on. Okay, over to you,
Okay.
Kok Wai.
Okay, thank you, Mr. Pei Kai-Xuan, for the interesting sharing. We will take some questions now. Just a reminder, please be sure to type your questions into the chat box. So it looks like we have a few questions, and I'm also very sure that Mr. Pei has answered quite a number of questions along the sharing. Just focus on the questions to be answered. So there's one question in the chat box, which goes like, do we diagnose dementia in stages, say like stage 1, stage 2, stage 3, stage 4, or we just diagnose by the extent of the symptoms?
Okay. Currently, I'm not aware that there's a staging of dementia, but during the diagnosis, the assessment, from the assessment score, usually doctors will do either MMSE or MOCA test. So that's the test for the dementia. So from the test score, we would roughly know how severe the symptoms is. So probably not so much of staging, but we did mention about mild, moderate, severe, these kind of differentiations.
Okay,
Yeah.
thank you. There are two more questions we received from participants during the registration. So first one is, has there been any methods proven to aid with dementia or Alzheimer? And yeah, this is the two questions in one question. Maybe the first question first. Any proven methods to help with dementia or Alzheimer disease?
Yeah, so there are two things that can help. One is pharmacological therapy, as in medications. There are certain medications that can help to slow down the progress of dementia. Okay, there are quite numbers of it. I think on the second talk of this series, you'll learn more about the medications, but they are oral medication, and now there are actually some patches in it's like a sticker that you stick at the back of the patients. But so Dr. Esther will talk more about that. The second one is more on the cognitive. There's something non-pharmacological treatment. So one treatment is called cognitive stimulation therapy. Okay, has been proven to slow down or stabilize the dementia symptoms. To say that it can go back, not really but it has been shown to slow down the progress of people with mild cognitive impairment, people with mild dementia. People with moderate severe dementia, it's probably a little bit difficult for them to participate in the in cognitive stimulation therapy. Really, early stage, yes. I hope I have answered the questions.
Yeah, thank you. There's the chat box. So it was mentioned many factors involved as the risk factors for dementia. So this participant asked, are there any critical factors among the list?
Among the list, okay. As I'm aware of, there are still no consensus of which risk factor is the most important one. Okay, but there are, instead of recognizing which are the most critical risk, the number one risk factors is probably age, but that's something that we cannot change. Usually we clinicians want to focus on modifiable factors instead of some factors memang cannot change, like genetics, something that we cannot change. Okay, you already inherited from the time that you are being conceived. So, but obesity is something that we can change. So instead of saying that which one is more critical, I guess what's more important is which one is modifiable. So these are the one that is modifiable: your diet, your activities, cognitive stimulation, physical exercise, and then cholesterol, blood pressure, smoking, diabetes. But why are you aware of any most critical risk factors other than age?
I think the consensus is about the age. The rest mainly focus on the modifiable risk factors as well.
Yeah. Okay. All right.
Okay. I think there are a few last questions, but I think they general group within the same area. So I just read out the last few questions, and maybe that will be the last question of the day.
Okay.
These last few questions generally involve this area. So let me read out the first question first. How do we help the public in general be more equipped with knowledge regarding dementia and Alzheimer, so that family who may have a family member with this disease will be more prepared in handling the situation? The second related question is how to respond to and care for people with dementia, and if possible, what caregivers and family members can do to support each other during the each stage progression.
Okay. All right. I answer the easier one first. The how can family members learn more about the symptoms and then support their caregivers at the different stages and probably different form of behavioral challenges? The answer is go and sign up for WHO online training caregivers program. It is free, FOC. You just need to register. As long as you know English, then you will be able to understand. There are people translating the manuals into different languages. Hope it will come out soon. This program is very, very detailed, teaching you how to handle different forms of challenging behavior. For example, one of the common behavior is they came out and then wandering around at night. So what do you do during that time? They refuse to eat. Okay, tell you it's meal time, but they refuse to eat. So there are many case study examples teaching you how to handle all this behavior, give you the verbatim, the script, what are the things to do, what things not to do. So arm yourself with knowledge, because that's the most important thing. Caregivers without knowledge is very unfortunate. You will be very, very, very tired and you don't know what to expect, what to do. Number two, what are the things that we can do to improve probably the awareness of the public? Agree with you. Awareness is super duper important. A lot of cases of dementia that I'm seeing right now, they came in during the middle or they came in usually is already with moderate level of dementia or severe dementia already, which is too late to do much things anymore. I hope that talk series like this, public exhibitions, maybe more TV programs, radio programs about dementia can be shared, and then there is then more people have good awareness. I think recently there's one Taiwanese drama series about dementia. So lots of Malaysian Chinese are watching that drama series, and they learn about dementia symptoms. So that changed their perceptions, reduce their stigma towards dementia, and also I'm actually seeing some people came to me saying, oh, after I watched that drama, I thought that I might have dementia, and can you help me to get a check? So yeah, so I think more efforts in this way is important. Okay, so that's all from now.
Yeah, thank you so much. I see no more questions already.